First Lady on HIV and AIDS, organization that is also on the area of HIV and AIDS as well as tuberculosis, encouraging them at every session they meet to tell them that we cannot separate HIV, AIDS, and tuberculosis. They go hand in hand. As well as such, every effort must be made to ensure that these twin diseases are being addressed with equal attention and for their eradication in Africa and in Nigeria. So on behalf of Our Excellency, I think I'm highly privileged and it's my honor to be here to welcome you all special guests to this very important section here in the State House. And we hope you enjoy it and enjoy the night. Thank you so much.
We are now in 2020. Can we honestly say that Nigeria has met the 2020 milestone? Also, in September 2018, the United Nations General Assembly, UNGA, dedicated one full day for a high-level meeting on TB with participation of heads of states, including our own president, and adopted a political declaration with key milestones which provided a political change that set bold and ambitious wide-ranging targets. Please, to Her Excellency, please let her know that we appreciate all our efforts in creating awareness for the control of TB, which include convening multiple meetings of stakeholders on TB for celebrities, private sector business leaders, and the wives of governors of the 36 states of Nigeria. She cascaded the efforts to end TB in Nigeria to subnational level by appointing all the wives of governors, including the wife of our vice president, as TB champions for their respective states. You have visited, she visited communities to conduct outreach programs and accepted to be a global TB ambassador and champion, a position she used effectively to disseminate information on the control of TB. These actions are most commendable. However, Nigeria has a long way to go if we have to end TB by 2035. For this to happen, the commitment and political will of government are essential. In India, the Prime Minister has committed to end TB earlier than the global SDG targets, has more than tripled the domestic budget for TB, and continues to include TB in his speech and in his monitoring initiatives. The Indonesian president has appointed the chair of the Indonesian National TB Partnership as an advisor and started including TB in his itinerary during visits to provinces. The Pakistan Prime Minister has asked the advisor to the Ministry of Health on TB to report progress to his office. Your Excellency, I believe that through your efforts, we can get our president also to commit to end TB in our country. A commitment he made at the 2018 UNGA meeting. His participation is essential, as this will ensure that the necessary funding required for control of TB will be made available, as we cannot continue to depend on external funders. I crave your indulgence. I think Dr. Hajo will pass this over. I crave your indulgence, Your Excellency, as our global TB champion and ambassador, to lead a delegation of TB stakeholders to meet with the president in the nearest future. Once she accepts to do this, we will get in touch with all the stakeholders that will have to meet with the president. It's also a great honor for me to share with you the reports It is also a great honor for me to share with you the reports of some of the high-level activities organized by Stop TB Partnership Nigeria. These reports will be very useful in our future advocacy efforts. Your Excellency, Honorable Minister, distinguished ladies and gentlemen, let us vow to end tuberculosis death in our lifetime for the sake of our future generation. It is a battle that can be won if we stand shoulder to shoulder with communities, health workers, and children everywhere. Let us put an end to this entirely preventable disease once and for all. Thank you very much.
Tuberculosis ailment, as we know, is not new. It's very old and still persisting. And the other ailments, the non-communicable diseases, which I called neglected communicable diseases because they are generally not even noticed. People don't take care of them. They are all typified by the fact that they generally don't cause much pain. They don't give many symptoms at the initial phases, and they begin to manifest when they are really becoming a huge problem. And because of that, the attention we have here is largely on the more dramatic disease programs and items, the outbreaks, the meningitis, the Lassa fever, the yellow fever, and things like that, which we hear of all the time. So it is therefore all the more fitting that this delegation is here. It's a multi-sectoral delegation from various agents and agencies and departments largely connected with the United Nations to draw attention to these diseases and also to stimulate us and get us thinking about what to do. Some of these are diseases that are actually genetic and can't be helped, like sickle cell. Others you can call self-inflicted, like alcohol excess and tobacco excess, which create problems not only for the consumer, but on occasion also for the environment. But nevertheless, they all constitute a burden on the health system, particularly if they are mature. It is wise to handle them at the early stage, and wiser still to prevent such onset. And that is why the Ministry of Health has welcomed this delegation to Nigeria and accept the stimulation they're giving us to pay attention to tuberculosis and neglected and non-communicable diseases. So, and it is therefore my pleasure to be a part of this advocacy meeting with members of the high-level joint programming mission of the United Nations Interagency Task Force on Prevention and Control of Non-Communicable Diseases and Tuberculosis, and also the Global TB Champion and Ambassador, First Lady of Federal Republic of Nigeria, Her Excellency Dr. Mrs. Aisha Buhari. This occasion is important. It's an important statement of the prioritization that is now going to be given to TB and NCD control efforts in Nigeria. This mission will support the government of Nigeria and partners and stakeholders in the fight against non-communicable diseases and tuberculosis. And the dinner we are receiving today is to appreciate the engagement of our TB champion and ambassador and further enlist her support for increased domestic resources for TB and non-communicable diseases. TB and NCDs are major public health problems in Nigeria, and Nigeria is among the countries in the world with a high burden of both. While some NCDs, like undernutrition, is also counted along with NCDs, and diabetes, they are major risk factors for TB. Some risk factors for non-communicable diseases are also major contributors to TB. Many interventions have been instituted to combat these diseases with some remarkable achievements. However, the statistics show that there is a lot that is still to be done. As a first step, a comprehensive national TB prevalence study is under development because we need to know the extent of our problem. The last one was done in 2012, and since then, our estimation is that only one out of four TB infections is actually being discovered and put in treatment. But we want to know exactly what the burden is, and we succeeded with the National AIDS Indicator and Impact Survey just not too long ago. And we got excellent results from that, which showed us that our HIV prevalence, which was thought to be around 3, was actually now 1.3. It helped us and also disaggregated the prevalence into states with high burden and states that didn't have a high burden, so you could focus treatment more accurately on those states that really had high burden. Because at that survey, some states had as much as 4, and other states had less than 1. So we hope that such a prevalence survey will help us to ascertain the true burden and the spread of TB in Nigeria for better resource allocation. Similarly, the non-communicable diseases require a step survey that is being planned to better assess the burden of NCDs in our country. Also, just like the recent National AIDS Impact and Indicator survey, both surveys will shed light on the true status and extent of TB and NCDs in Nigeria, so we know where we are starting from. Now, the government of Nigeria places high premium on human capital development and prioritizes the achievement of universal health coverage. Combating TB and non-communicable diseases will require even more effort. Our global TB champion and ambassador and First Lady of the Republic, Mrs. Aisha Buhari, has given unflinching support to TB and NCD control efforts. Her Excellency further demonstrated commitment to TB control by inaugurating the wives of all 36 state governors, the wife of the FCT minister, and also Her Excellency, the wife of the Vice President, seated here with us today as TB champions, which was done in December 2019. So the government of Nigeria extends thanks to the United Nations and all partners who have contributed to the control of TB and NCDs in Nigeria. I want to tell you that there's more to do, and we need you to be on our side. Our focus is now to mobilize adequate resources from both domestic and international sources. This is a collective task for all stakeholders in this ecosystem. We must work collectively and together to achieve the sustainable development goals in that respect. Thank you for listening.
Another round of applause for the soft-spoken but action-based man who is in the helm of affairs of the Federal Ministry of Health. Thank you so much, sir.
That we're living in the era of people-centered care. Sometimes we're facing with the situation because of very difficult treatment of patients with MDR-TB, then we have a choice what to do. Because of numerous side effects, they have problems with the heart, with the other systems, and what to do, continue treatment of the tuberculosis or stop and pay attention to other dangerous symptoms. And that's why we need to work together. And the patient should not go from one doctor to another doctor. Doctors and services should come. And that's why primary health care and access to all the services at the lowest level is crucial. I would like also, being myself mother of 3 children, would like to address again Your Excellency's that your role in the advocacy for the women and children, for providing screening, prevention, will be also crucial. Because sometimes children, especially young children, they cannot protect themselves, and mothers should be engaged, they should be aware. And unfortunately, children are among the most neglected. If we look at the numbers, only 90% of those who need preventive treatment have access and are provided by this preventive treatment. So we'll not go into the details. Much more should be done. But with your support, with your leadership, we hope that we will achieve, I believe, because we should be optimistic. There is no chance to meet any targets, to provide success, to lead people if you not believe in the success. We should believe, and we should do our best. I immediately fall in love with Nigeria when I came. I am for the first time here. To the beautiful country, beautiful people, dedicated, hardworking, and we will stay as all UN family next to you and provide all requested support to make Nigeria from high burden country to the first champion in the region, and to protect your people. Thank you very much once again.
It is my pleasure to represent the First Lady of the Federal Republic of Nigeria, Dr. Mrs. Aisha Muhammadu Buhari. I am assured that you have graciously accepted her apologies for her absence here today. Here are the remarks by Her Excellency, Dr. Mrs. Aisha Muhammadu Buhari, Dr. Mrs. Aisha Buhari, the First Lady of Nigeria and Global TB Champion and Ambassador at the advocacy meeting with the Joint United Nations Mission to Nigeria. It gives me great pleasure to welcome you to Nigeria. I hope you have experienced our warm Nigerian hospitality. Thank you for undertaking this noble mission. This is very important and timely. Nigeria faces a huge TB burden. I believe your mission to Nigeria is not to restate what we already know, but to assess what we are doing with the aim of supporting us to do better. Since my appointment as the Global TB Champion and Ambassador in 2016, I have joined other world leaders to advocate for more support for TB at the national and global levels. I have been privileged to speak at the coordinating board meetings of Stop TB Partnership, high-level panel and gala night, and as a keynote speaker at the United Nations high-level meeting on TB in New York. In Nigeria, because awareness of TB is still a major challenge, I have used both the traditional and social media to create more awareness on TB, as seen on some of the video and photo clips shown this evening. I have participated in major programs organized by Stop TB Partnership Nigeria, especially the national TB conferences held in 2016 and 2019. During the World TB Day last year, I hosted the TB community and stakeholders to a gala night to celebrate TB champions and survivors. This was the first time in Nigeria where organizations and individuals who have dedicated their lives to end TB in Nigeria were publicly appreciated. Also, during the World TB Day last year, I personally visited a rural community here in Abuja to create more awareness about TB and to support and intensify TB case finding. Furthermore, last year, we had a consultation with the corporate sector in Lagos State to discuss how to mobilize domestic resources to end TB in Nigeria. Lastly, towards the end of last year, I conducted an investiture for all the wives of governors in Nigeria, appointing them as TB champions, because TB programs and services in Nigeria are decentralized to state and local government levels. The appointment of the wives of governors as TB champions is a game changer, as it will help to cascade information and support for TB to the lowest level, especially the much needed support of the state governors. A lot has been done, but we can do better. Our ultimate goal is to end TB in Nigeria. And while we may be patting ourselves on the back, only outsiders like you can tell us the truth about what we are doing, how we can do it better, and what we need to do more to end TB in Nigeria. That is why I said earlier that this mission is very timely, because we have started planning various activities for this year's World TB Day. So I look forward to your recommendations, and I promise to advocate for the implementation of any action that is agreed upon. I also want to solicit for more of your support. As you know, ending TB in a country as big as Nigeria is a huge task, and we need multi-sectoral, multilateral support for us to achieve it. One major area where support is much needed is to strengthen the capacity of the wives of the governors who have been appointed as TB champions to be effective in this role, and also to support structures at the state level to support them. It is therefore my greatest pleasure to launch the campaign to kick out TB in Nigeria. On this note, I welcome you again to Nigeria. Please take time to explore the country. Our beauty is in our diversity. I wish you a successful mission. Thank you.
TB continues to be a major global health challenge as women and children continue to die needless death from a preventable and curable disease. As a global TB champion and ambassador, I'm calling on all stakeholders to double their efforts to end TB in Nigeria. TB is curable and treatable. TB tests and treatment are free in Nigeria. I therefore ask all Nigerians and everyone living in Nigeria to find TB and treat TB. Therefore, anyone who has been coughing persistently for more than 2 weeks should visit the nearest health center to get tested. Let us work together to end tuberculosis in Nigeria.
All persons arriving from China or any country that has a major outbreak is advised, if they have no symptoms at all, to self-isolate, meaning that they stay indoors in their homes for at least 2 weeks. And if they develop any symptoms like cough, catarrh, sneezing, breathing difficulties within this period, to report to the nearest health facility. We're also advising all airlines to report any case of a passenger falling sick on board before the plane lands. That is a requirement in the agreement. Nigeria Port Health Services and Nigeria Center for Disease Control are on alert at our airports and other points of entry.